The hospitality industry is taking measures to provide low-contact service for guests and team members. Guest rooms, restrooms, kitchens, lounges, and fitness areas are of primary concern. The greatest threat is from airborne particles that can linger in the air for hours. Watch this.
One of the top questions we see from you, how does the coronavirus spread? Scientists are revealing new answers every day. The main method is when an infected person coughs or sneezes, sending out droplets into the air. Early research showed those droplets could travel up to 6 feet, but a new group of researchers thinks it could be even further. Take a look at this. This is a model they created that shows what happens when you cough in a place like a grocery store. Look at that. Look at how the cloud spreads. The researchers say an infected person could cough and walk away, but they leave behind small particles carrying the virus, which can end up infecting others. And those particles can live in the air for a while. Researchers at the National Institutes of Health, the CDC, UCLA, and Princeton found the virus can live in the air for about 3 hours.
VidaShield UV24 is a UVC light antimicrobial environmental air purification system. It combines an ultraviolet germicidal irradiation UVGI chamber and air circulating fans with an overhead ceiling light. UVC has been shown to kill SARS-CoV-2, the virus that causes COVID-19.
Why not consider the air? Doctors wear masks during surgery. Dental hygienists wear them during routine procedures. There is risk of spreading C. diff from simply flushing a toilet. And well child visits account for 700,000 new cases of the flu each year, costing $500 million. UV has been used as a disinfection tool for decades in healthcare. But the challenge with UVC technology has always been the method of delivery. It can't be used in occupied spaces and is only effective in areas that are direct line of sight. Until now. That is exactly what makes VidaShield different. Operating 24/7, 365 in occupied spaces, VidaShield is a fast, continuous UVC air purification system that reduces the levels of bacteria and fungi in treated air and reduces the settling of viable bacteria and fungi on surfaces. Healthcare staff have reported improved indoor air quality and reduced odors. Once VidaShield is installed, it requires no engineering controls to operate and minimal maintenance, which helps keep operational costs low. VidaShield is designed for use in hospitals, long-term care facilities, nursing homes, schools, commercial office buildings, and any other location where cleaner environmental air is desired. The energy-efficient VidaShield is available in 3 styles.
On May 27th, the CDC updated their interim guidance for businesses and employers responding to coronavirus disease. As a part of their recommendation to improve ventilation, they suggest ultraviolet germicidal irradiation, a method of disinfection that uses short wavelength ultraviolet light, UVC, to help inactivate the virus. The CDC refers to ASHRAE, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, position document on airborne infectious diseases. ASHRAE recommends installing UVC fixtures on or near the ceiling to irradiate upper room air, disinfecting the air directly within the occupant's breathing zone. The fixtures are recommended when ventilation rates are low and are typically mounted at least 7 feet above the floor. UVGI in the form of UVC light has been recommended or used for the isolation of disease and biodefense systems for buildings by the United States Army, the CDC, and the Federal Emergency Management Agency, FEMA. The size of this typical restaurant floor plan is 1,084 square feet. The configuration accommodates 82 patrons. The red squares represent open tables. The blue circles illustrate the 6-foot social distancing guidance recommended by the National Restaurant Association. Adjacent tables within the 6-foot radius need to be closed to conform with the NRA guidance. Of the 82 seat capacity, 34 must be closed. This represents 41% of the available seating. A restaurant of this size and configuration will require 4 units to achieve 93% zonal protection every 43 minutes. This financial model is based upon the previous restaurant floor plan with 1,084 square feet, accommodating 82 patrons. The percentages of total costs of 13% rent mortgage, 2% recurring fixed costs, 5% marketing costs, 40% food costs, and 30% labor costs represent industry standards for any size restaurant. The full-service model's revenue is derived from the industry standard break-even of $165 per square foot. Notice on the third column that fixed costs such as rent, recurring costs, and marketing costs don't change as seating capacity is reduced. A 58% reduction is applied to variable costs such as labor and food costs. The 41% reduction in seating capacity results in a change from a 10% profit to a 5% loss. VidaShield units can be installed for a fraction of the loss, allowing full capacity operation without turning any customers away. Leasing is available to preserve cash flow. VidaShield also qualifies for immediate tax credits. Your restaurant can advertise the distinction of having the cleanest, safest air and environment for customers and staff. Units can be installed in the ceiling or suspended and can be configured to match the casino or restaurant's aesthetics. Some casino and restaurant owners prefer the units to be conspicuous, so guests can see visible evidence that their health is being protected.
Operating 24/7, 365 in occupied spaces, VidaShield is a fast, continuous UVC air purification system that reduces the levels of bacteria and fungi in treated air and reduces the settling of viable bacteria and fungi on surfaces. Healthcare staff have reported improved indoor air quality and reduced odors.
Make sure that once your facilities reopen, they remain open with VidaShield. The exterior large format transparent displays deliver spectacular display experiences while maintaining the architectural look and feel of the building. In addition to advertising, during the COVID-19 pandemic, public service announcements can display everyday prevention actions, readiness, cleaning and disinfection, social distancing, steps for other adults, etc.